Rinne's and Weber's tests. Hearing loss is the most common sensory defect in humans. Out of all the cases, 1/4 occurs in childhood. There are two types of hearing loss. First one is the conductive hearing loss, in which sound transmission in external or middle ear is impaired. This impacts all the frequencies of sound. Common causes include plugging of external auditory canal with wax or foreign bodies, infections of the external or middle ear, perforation of the eardrum, and osteosclerosis, in which the bone is resorbed and replaced with sclerotic bone that grows over the oval window. The next type is the sensorineural hearing loss. It occurs due to damage to the cochlear hair cells or problems with cranial nerve 8 or within the central auditory pathway. Causes include excessive noise, which damages hair cells, ototoxins such as antibiotics, diuretics, and chemotherapy, gradual hearing loss with age, termed as presbycusis, and genetic causes, which can be syndromic or non-syndromic. To test hearing loss, we use two tests in the clinical setting. They are the Weber's test and the Rinne's test. Now let's see how each test is performed. Before we get started, it is important to note that in a normal ear, the air conduction of sound is perceived louder than bone conduction.
These are a set of tuning forks. So when we come to our OSCEs, when we are asked to perform either the Rinne's test or viva's test, so we have to first identify which tuning fork we are supposed to use in the test. So can some doesn't even know which frequency we commonly use? 512. Yeah. So 512 is the one we use. So this is the 512 one. So yeah, the size of the tuning fork is in the descending order of the frequency. So the higher the frequency, the smaller the tuning fork. So we get the tuning fork, and ideally we should hit a hard rubber, right? So after hitting a hard rubber, like imagine I'm hitting hard rubber, then if you are first thinking of doing the Weber's test, which is the simpler one, can I have a volunteer? Come. So once we hit the tuning fork and get it to vibrate, we place the tuning fork's this foot end on the vertex. So in this case here, right? So then we ask, can the patient hear or not? And if so, we ask whether the patient is having any discrepancy or not with regards to both ears. So as I mentioned, in normal patient, there is no discrepancy, right? So in a patient who is having a conductive hearing loss, the sound coming from the external ear are not heard. So the ambient sound from the environment is not muffling the bone conduction. So the affected ear hears more in conductive hearing loss. So in sensorineural hearing loss, there is nothing heard from that ear. So the unaffected ear hears more, right? So that is Weber's test. So in the Rinne's test, we like I'm hitting the fork again and getting it to vibrate. So and we place it first on the mastoid process. So this is the mastoid process. We are doing this to assess the bone conduction first. So after hitting, we are keeping the ear, the tuning fork like this. So we are assessing the bone conduction. Then we place the tuning fork near the ear. So now we are testing for the air conductions. Clear? So as I mentioned, we have to check for both ears in this case. And in a patient who is having conductive hearing loss, the air conduction is not heard, right?
In sensorineural hearing loss, vibrations are heard in the air after bone conduction is over, as long as nerve deafness is partial. When the air conduction is louder than bone conduction, it is Rinne positive. When bone conduction is louder than air conduction, it is Rinne negative. Rinne positive can mean either a normal ear or sensorineural hearing loss. Because the conduction mechanism through outer and middle ear is functional, sound is heard louder in front of the ear. Rinne negative means a conductive hearing loss. A subjective measurement of hearing loss can be assessed using pure tone audiometry. The patient is given a pair of headphones which play sounds at different frequencies. This assesses the patient's hearing at different frequencies and marks them in a graph. That brings us to the end of this video. Thank you for watching.